We're just going to get started here in a couple of minutes as we let people get into the webinar. Welcome, everyone. Great. Okay. All right, folks. Thank you very much for joining us. Good morning, good afternoon, good evening. I'm Dr. Stephen Connor, Executive Director for the Worldwide Hospice Palliative Care Alliance. And today, our webinar topic is going to be the 2023 World Hospice and Palliative Care Day Community Strengthening Toolkit webinar. So we'll be talking all about the new toolkit for World Day this year and the themes that we have. But first, let me introduce my fellow panelists. After I do a brief introduction to World Day, we're going to have Howard Kinua, our communications manager, walk you through all the content and the key points of the new World Day toolkit and how to use it. We're fortunate to have a representative from the organization Public Health and Palliative Care International, the home for the Compassionate Communities movement, Guy Perrier from UK, on creating compassionate communities. And also briefly, we'll have some words from Dr. Helena Davies, who's the advocacy officer for WHPCD currently, and we'll be talking about people with lived experience of palliative care in World Day and the importance of inclusion of people with lived experience in all the work we do in palliative care, from policy to communications to advocacy, and the importance of including people in World Day events as well, which is part of our goal for the year. Many of you may know that we published the Global Atlas of Palliative Care with the World Health Organization, and this is the source for a lot of the information and data that we collect. Very briefly, the need for palliative care is, we think, well over 60 million people a year now, though in 2019 we had estimated at 57 million. We have about 54 million deaths, or 1 million people a week who die, more than 1 million people a week who die on our little planet. And more than around half of them need palliative care. Not everyone has a condition that is amenable to palliative care intervention. Most of those people, well over 80%, live in low and middle income countries. So that is really where the need is and where the disparity is. We have about at least 50% of the need for palliative care being met in high income countries, but only about 4% of the need being met in low and middle income countries, where most of the need is. Most people are older, but we also need palliative care for children. And the majority of the people that need palliative care are currently still dying in pain because of lack of access to opioids in most of the world. And then, of course, we have a large number of people grieving after anyone dies, and many people attending services. So the first World Hospice and Palliative Care Day was actually back in 2005, which was almost 20 years ago. And we celebrate World Day each year on the second Saturday of October. We celebrate hospice and palliative care throughout the world. And this was the logo. Sorry, this is the logo for this year, which is Compassionate Communities Together for Palliative Care. And we think that compassionate communities are a natural ally, if you will, of palliative care, and an extension of what palliative care can do in terms of helping people with serious illness and those who are grieving. So we organize, as I said, World Day, focused exclusively on palliative care development with input from our other palliative care colleagues, the International Association for Hospice and Palliative Care, the International Children's Palliative Care Network, and Palchase for Humanitarian Emergencies. These were some of the themes we've had in recent years. Last year was Healing Hearts and Communities. It was largely about the pandemic and the impact it was having on the world, both grieving people and those with serious illness. 21 was Leaving No One Behind. It was about equity and access to palliative care. 2020, a focus on symptom relief and comfort. 2019, human rights and the need for palliative care to be considered a human right. 2018, again, about people. This is a quote from Cicely Saunders, palliative care because I matter. It's an adaptation of one of her famous quotes. 2017, universal health coverage in palliative care, which is still a huge issue for us. And then finally, living and dying in pain for 2016, with focus on the inequity and access to essential palliative care medicines. So our aims in World Day are to increase the availability of palliative care, to increase awareness and understanding of all the needs, medical, social, practical, and spiritual, and to raise funds to support and develop hospice and palliative care services around the world. We have made some progress. In 2011, we surveyed levels of palliative care development globally and identified about 16,000 services caring for about 3 million patients. That number had increased by 2017 to 25,000 services caring for 7 million, but that's still 12%, only 12% of the need being met. For those who may not have seen the report from WHO that came out on actionable indicators, this is the new public health model for palliative care. We've added research and empowering communities and people to the model. And I think it's a more robust and effective model to describe what we do in palliative care and what we need in order to build palliative care, including, of course, policy, medicine, education, and integration of services. So for today's webinar, please feel free to introduce yourselves in the chat. Put your questions in the Q&A box, please. We'll be monitoring that. We hope to have time at the end, around 15 minutes, to answer questions. And please contact us if you need to or need assistance in advocating for palliative care in your country. Thank you very much, and I'll turn it over to Howard Kinyua, our Communications Officer. Howard, over to you.
Thank you, Stephen. As you've heard, my name is Howard Kinyua, and I am the Communications Officer for Worldwide Hospice and Palliative Care Alliance. So today I'm going to be taking you through the toolkit just in bits so that we can break it down to try and simplify it for you as you plan to use it for the campaign on the 14th of October. So next slide, please. So we're going to be unpacking the toolkit, and as we've heard, the theme for this year is Compassionate Communities Together for Palliative Care. Next slide. Okay, so about World Hospice and Palliative Care Day. So it's a unified day of action in support for hospice and palliative care. And World Day has been marked every year since 2005, as Stephen has said. Palliative care improves the quality of life of people facing serious illnesses, not just in the end of life, but throughout the whole trajectory of illness. So it's right from diagnosis and up to the end of life. So that is why the work that we do matters so much. And compassionate communities care for people and assist people to live in the place they call home, connect people to services, and raise awareness about end-of-life issues. And that is why we chose the theme for this year. Next. Palliative care is a major unmet need across the world, and Stephen has already mentioned this bit, where only 12% of the nearly 60 million adults and children in need of palliative care services receive it. So we take this opportunity every year to raise awareness about palliative care and to mobilize support, for palliative care from communities and governments worldwide. So This day is organized with other organizations, and Stephen has already mentioned this bit, so we'll move on to the next slide. So this is a diagram that you can find in the toolkit. It's just to emphasize that patients and families are at the center of community and caring. So when we give care, that just shows as the circle gets wider. So from patients and families, so that image shows the nuclear kind of family, but we are talking about the wider community. So we have nurses, physicians in the next circle, and then it gets wider to now stakeholders such as health facilities, government, and the like. But you can find this diagram in the toolkit, so and you'll be able to see it later. So next slide, please. So we chose some sub-themes, and the first one is compassion, I beg your pardon, is in us to give. And a compassionate community comes together to help and support others experiencing death, dying, suffering, and loss, with a shared goal to improve serious health illnesses, care and bereavement, support for everybody through kindness, compassion, and action. So it is in our heart to give, and one of the things that we can give is compassion. Having a heart of compassion is a gift, and you're able to extend it to people who need care, and in our case specifically, people who need people who are living with palliative care needs. And the next one is compassion is equity, and increase in access to hospice and palliative care services continues to be a challenge in different parts of the world, especially developing nations where access to healthcare facilities and good quality care continues to be a challenge because of the different levels of development and also the bureaucracy of government and also other entities. So governments, policymakers, and palliative care providers should work together to develop and implement national palliative care strategies. Collaborating with regional partners is key in integrating change and creating lasting change that directly affects the community. So the final one is compassion is care, and too often there is no available care for people living with serious illnesses and their caregivers. We need more home-based care and primary care workers with palliative care skills. Next slide, please. So we have some key messages for the campaign, and we also chose this just to emphasize more on the theme for the year. And first one is compassionate communities as a way to complement existing palliative care services. So compassionate communities and compassionate cities recognize the central role that chronic ill health and related mortality plays in the minds, behaviors, and social meanings that people develop when confronted with experiences of serious illness, pain management, aging, caregiving, and loss. Compassionate communities aim to enhance traditional health promotion with health promotion specifically aimed at addressing issues related to caregiver support. The next one is compassionate communities promote a holistic definition of health. And this brings an emphasis, or it should bring an emphasis on focus on the strengthening of social capital, mutual aid relationships, and the ability of citizens to actively participate in the development of their communities to create social connections and to care for each other. The next one is compassionate communities are rooted in health promotion approach to palliative care. And compassionate communities, it's a globally recognized approach to improving the end of life experience for people, mobilizing local networks, groups, and services to be more cautious and aware and equipped to offer support. Next slide, please. So the key ask for this year is we call upon governments, policymakers, health professionals, community activists, volunteers, people with palliative care needs, and others to come together to encourage the growth of compassionate communities and cities linked with palliative care over the world. And my colleague, Helena, will expand on this when she talks about advocacy. Please. Yeah, next slide.
One with the chat.
Thank you. I understand.
So if you have comments or if you want to introduce yourself, the Q&A.
Okay. So you have additional resources, and this we have logos which you can find in the toolkit, and you can download them from our website. So that's the WHPCA website. And we will currently have these resources in the English language, but we will have them in other languages like German, French, Portuguese, Russian, and Chinese, because those are the widespread or languages that are commonly spoken across the world. But yeah, we will have them in the coming weeks. So we have our logos. You can use them on your social media feeds and also on different platforms, just to mobilize and to encourage people and to bring awareness about the day. Then we have a drafted press release. This one, it's already drafted, but you can customize it to your needs or to be able to communicate with the different members of the press in your community. So you can customize it to fit the local and regional press. The government petition letter for advocacy. So we also have this drafted. You can find the link in the toolkit, and you can also download it from our website. So this one is just a brief or just a drafted document to help you to petition for palliative care services in your different regions. Then we have a fundraising tips sheet. So this one is just to give you an idea of how to use this day to fundraise, because we know that in the recent years, funding for palliative care has been quite a challenge for different facilities and across the globe, actually. So you can use this day to fundraise, and we have just a few tips there to guide you. Then we have working with the media. It's good to use the press just to bring awareness. It helps when people know about the services that you offer that are available for people living with palliative care needs, because we've seen usually people are referred to palliative care by their physicians and caregivers once they've reached like the final stages of dealing with an illness. So it continues to be a challenge. We need to bring awareness to let people know that these services exist in the first place, and also to propel the messages of advocacy. And then finally, you can film yourself. There are tips over there on how you can use your mobile phone to film yourself and release the messages that you want to send across to advocate for palliative care services. Next slide, please. So ways to participate, we have compassionate communities activities. And so this can be, you can hold, you can reach out to members of the community with serious illnesses or who are near the end of life, and their families if you can, and show them that you care. So you can, if it's possible, reach out to different people in the community who need compassionate communities, or they do not even know that compassionate communities exist in the different communities, and just to reach out to them and make them feel that we actually, or you actually care about them. And then you can educate your city, town, village, or neighbors about compassionate communities and compassionate cities, and explain the health promotion approach to palliative care. And then you can turn communities into compassionate communities by meeting the 13 steps in the Compassionate Communities Charter, which will be executed later. And then next one is solidarity. So you can unify with different members in the different regions to communicate or to drive this message forward to help you in your advocacy efforts. So through social media, and also you can hold different events and maybe walks, and you can have different activities where you can come together and push this message and advocate for palliative care services. You can engage your community to participate in World Hospice and Palliative Care Day. So this one, you need to mobilize people to participate in World Day, and then you can engage the media. Already expanded on that in the previous slide. You can record a short video. So this can be not just yourself, but you can also involve different people in your organizations or health facilities in the compassionate communities to record videos to bring awareness and to spread the message. Then you can engage different stakeholders. This is like the government, Ministry of Health in different regions and the like. Still on advocacy and to push the message forward, and then reach out to public figures. So you can find people who are authority figures who are relevant in the healthcare space in the different regions, who will be willing, hopefully, to speak about palliative care and the importance it has in our communities and society. And hopefully that will bring about some change, because some people do wield some influence. And then World Day campaign with targeted objectives. So you can use this day just to find out what are the bottlenecks, because we've been campaigning for the longest time for palliative care services to be integrated fully into healthcare services in different parts across the world. So what are the challenges? You can do a root cause analysis to find out what is the challenges, why is it a problem, why hasn't it been achieved? And then we can come up with smart objectives that are targeted, relevant, time-bound, and so that you can have meaningful outputs in the end. So, and then finally, if you are able to do a campaign, but this one can be tricky, because if you're going to do a campaign, you need to have a budget for that. You also need to measure the activities that we are going to be undertaking, so that we see, are we making progress? What are the challenges? Where did we miss out? Where do we need to improve? And also moving forward, what are the next steps when we move forward? So it's good to measure the different activities and strategies that we use on this day, or to advocate for palliative care services. Next slide, please. So communications tips for reaching a diverse audience. You can use a variety of communications channels. So these are we've talked about media, that's mainstream media. You can also use your digital spaces like social media. And this is quite an active tool, because many people are on social media today, and some people may not even be aware about palliative care services, but they can get this message across. You can also use hashtags, and also encourage people to use the same hashtags, like World Hospice and Palliative Care Day 2023. Compassionate communities is another main hashtag, and that way, even it will also help us to see the activities of the day. We can also monitor social media activities that have been going on during the World Hospice and Palliative Care Day. So social media is one of the most active tools, but there are also different channels you can explore as well, and then you can develop content for each audience. So who do you want to communicate with? The message that you're going to send out to the government, and the government to try to petition is not the message that you'll send out to maybe the public to bring awareness. So you need to customize these messages to make sure that they are targeted to the right audience, and each one that it's relevant to each audience. Then next, cultivate strategic partnerships while keeping target audiences in mind. So this is with the different stakeholders and also people that you will engage during this campaign. And you can also recruit influencers to help promote your brand. So we need to be careful about this. The people that you use as your influencers, their reputation matters. And also, as I said earlier, when you're using people who will be spokespeople, they can also be part of this, they can also be considered influencers. And then you can address communication barriers. This now ways to communicate. Maybe some of the people, do you need to use sign language, or what are the barriers to communication to the different types of audiences? And how do you mitigate these challenges? So so that's a question you need to know. Different audiences may require different approaches to communication. Next slide, please. So I'd like to thank each and every one of you for attending this webinar, and also for planning to be part of this important initiative. And be sure to register your events on the World Hospice and Palliative Care Global Map which you can find the link in the toolkit, and you can also go directly to our website and register your events. We are curious to find out what you've planned for the day, and we want to know what you're doing, and it will also help us to measure the impact of World Day across the globe. So thank you so much, and Stephen, back to you.
Okay, thank you very much, Howard. We're gonna try and see if we can get chat to be re-enabled. If you'll give us a second here. It should have been activated, and I'm not sure we can get it to change during while we're still in the webinar. I'm afraid we'll have to fix that problem later. But meanwhile, as I said, please do use the Q&A. Q&A is working, so if you want to make any comments or say hello or put in questions, please do. We need to hear your questions, especially so we can address them during the webinar. And I'm going to move on now to our next presentation. Okay, Guy, over to you.
Thanks, Stephen. So my name's Guy. I'm based in the UK, and I'm a member of PHPCI. And I'm just going to talk to you just for 5 minutes about the role of PHPCI and more about compassionate communities. So I provided quite a few QR codes in the next 4 slides. So if anyone's interested in reading more, it might be time to get your phone out. Okay, so next slide, please, Stephen. So just quickly, what exactly do we mean by a public health approach to palliative and end-of-life care? And in its acknowledgement that it's going to happen to us all. And in the traditional routes of palliative care, I remember a famous study in London where it traced back a dose of water poisoning, managed to locate it to a specific pump in East London. And that was around, ideally, public health approaches around prevention. And if you can't prevent something, harm reduction. So you might think to yourself, well, we're not really in the business of trying to prevent death, nor can we, but we can reduce harm. And we can prevent some of the things that go alongside death, dying, and grieving. And these may be known as the comorbidities that go hand in hand. And they are amenable to a community response. And because of the prevalence of dying, we acknowledge that it should be everyone's responsibility to participate in helping people to improve this support and care for people that are ultimately at one of the most distressing and difficult times in people's lives. And the other key concept around public health approaches is early identification. So we should be thinking about people's social support structures when their time of need comes. So when they first maybe get a diagnosis. So it's also acknowledgement that the way that people are dying has fundamentally changed. Cancer, heart attack, stroke are not necessarily terminal diagnoses these days. So the way that people are dying has become more complex, and as a result, interventions are becoming more complex, and it's not just the business of services. Next slide, please, Steve. So just quickly about PHPCI, it's an international association, and it's there as a support mechanism to share good practice, learn from each other, facilitate communication across the globe, and more importantly, try and embed this idea of a public health approach into palliative and end-of-life care services. And as I mentioned, so the core aims that Howard also discussed, mainly around health promotion. So there are still loads we can do to try and promote well-being in these days, what can be quite an extended period of time in periods of ill health. We need to encourage more collaborative links between services and non-services. And realistically, in higher income countries, we have huge problems with expanding demands, workforce concerns, and for those people, the care practitioners who are working on a daily basis, they have workload concerns. So that is tantamount to challenging people's experiences. And services certainly need our support as well. And lastly, PHPCI provides an active forum for people to feel included and discuss with each other their activities and their goals for developing interventions in their country. Next slide, please, Stephen. So I love this quote by the pioneer of compassionate communities. And it's, as it says there, dying is a social event with a medical component, not a medical event with a social component. So we need to think about going into history. It hasn't been the domain of medical services primarily. It's an opportunity for us as humans to come together and support each other and celebrate some of the more, well, the beautiful parts of life, and to come together to support each other in some of the most difficult times in life. So next slide, please, Stephen. Now, Howard presented a slide not dissimilar to this. This comes in the form of Circles of Care, a paper by Julian Abel. And for, again, higher income countries, it's not until you get out to the outer extremities of their circles is where service providers are. If you think about the people that are closest to the person who may be dying, as well as the people close to them, i.e. their carers and family, they're the people who spend the majority of the time closer to the person who may be dying. And that's where we aim to provide the bulk of support. And that comes down to this idea of the 95% rule. And that Alan Kelleher says is that it's only 5% of the time that a person experiencing palliative and end-of-life care that may actually come into contact with a healthcare professional. The rest of the time they're flying solo. So it gives us a huge opportunity of places and time where we can support. And if you haven't had an opportunity, I'd encourage you to have a look at the Lancet Commission and that bottom QR code that is an open access document. And it certainly provides some key pointers about how we can move forward together. Next slide, please, Stephen. Oh yeah, okay, apologies. But here's a nice, I guess, GIF of trying to put it in context. What we've got here is a series of cogs, but it's the scale of the cogs that's important. Specialist services may be equated to hospitals or hospices, but actually fewer of us, as we get into the period approaching the end of life, actually require specialist intervention, but we all require support. And that's where the compassionate communities as a larger cog comes in. But part of PHPCI and part of compassionate communities is trying to break down those barriers. So we consider this idea of interface between care and services and non-services, and how we can try and work together to support people with serious illness. And I think this will be the last slide, Stephen.
Yeah.
And here is a QR with some joining opportunities. But certainly if you have any questions, feel free to contact that address. And we've really enjoyed having a close association with WHPCA and World Day. And we hope to continue this relationship. So thank you.
Yeah, just thank you very much, Guy. I might also mention that there is a World Compassionate Communities Day coming up in its, what date exactly? Do you remember, Guy?
That's November the 1st. So hot on the heels of World Day. So some of the activities that go onto the world map that Howard mentioned would also be eligible for that. But certainly social media is your friend with those hashtags that Howard mentioned as well. So I think there'll be continuity in your activities and hopefully a flourishing of excellence that comes out of it.
Great, two very well-related movements, palliative care and compassionate communities. We're going to move on now to Helena Davies' presentation, briefly on people with lived experience. Over to you. You're muted, dear.
Sorry about that. Would help if I took my mute off. Thank you, Stephen. My name is Helena Davies and I'm the Advocacy Officer for the WHPCA, but I'm also someone with lived experience of palliative care and serious health-related suffering. And that gives me perhaps a unique perspective on what I'm about to say, in that I feel very passionately about the input of people with lived experience, but it's an increasingly recognised phenomenon and one that I think we really need to commit to. Next slide, please, Stephen. So people with lived experience are people who've experienced or cared for someone receiving palliative care or end-of-life care. And we've heard a lot about the fact that a lot of those people are actually, the huge majority are actually family and carers rather than health professionals. Palliative care isn't just about end of life, it's about the whole trajectory of illness, as Howard alluded to when he was speaking. And I'm perhaps a good example of that. I've actually been having palliative care for over 10 years and continue to receive palliative care, and it's made an enormous difference to my own quality of life. People with lived experience of palliative care, whether that is themselves having experienced it, either some people in the past and having now being in remission or cured from the condition that they received palliative care for, people who've got ongoing palliative care long-term like myself, or people who are nearing the end of their lives and are receiving palliative care and end-of-life care, and those who, and that also will include those who've cared for someone with who had palliative care who's now passed on. But people with lived experience of palliative care bring their own expertise, and it's a unique expertise that should be valued equally with technical expertise. So it's not any less valuable because it's different. It's not any less valuable because they haven't got a degree from university to support it. It's equally valuable, and in some instances more valuable, because it's a very persuasive story to people who you're trying to persuade to commit to palliative care. And it's a very important part of advocacy for palliative care. And really, input should be meaningful and not tokenistic. So it's easy to just tick the box and put a person with lived experience at the end of the table. But if you don't actually involve them in the work that you're doing, then it's not worth doing. And what do I mean by meaningful involvement? Next slide, please, Stephen. The WHO, next slide, please. Sorry. The WHO have recently published a framework for meaningful engagement of people living with non-communicable diseases and mental health and neurological conditions. And although this isn't specifically related to palliative care, I think a lot of what's in it, and it's an excellent document that I would highly recommend you having a look at if you're not familiar with it, in terms of meaningful engagement of people with lived experience. The basic principles are the same, whether it's meaningful engagement of someone living with non-communicable diseases or meaningful engagement of someone living with palliative care needs. And it's about respectful, dignified, and equitable inclusion of individuals with lived experience. And we've heard the word equitable a lot already this morning, well, this afternoon, this morning, depending on where you are, this evening, even in some places. So it's about equitable inclusion of individuals with lived experience in a range of processes and activities within an enabling environment where power is transferred to people. So the power isn't staying with the stakeholders, the official stakeholders and the healthcare professionals, is being transferred to the people, and valuing lived experience, as I said earlier, as a form of expertise and applying it to improve health outcomes. We're not talking specifically about improving health outcomes with World Day, but inevitably, if we can persuade some people of the importance of palliative care, we will indirectly improve health outcomes. And I think that's worth remembering, that that is a larger aim of the day. Next slide, please, Stephen. So the question then is, if we're agreeing that it's important to involve people with lived experience, the question is, what's the best way to involve them? Well, as you'll see when I get to the end, I think you can involve them in all aspects of World Day, but films are a particularly powerful way to include people with lived experience. They provide insight into that lived experience, and it's an opportunity for people with lived experience to tell their story. And that often really draws people's attention, captures people's attention, makes palliative care seem real to them rather than an abstract concept. It's sometimes quite difficult if you've got specific messages that you're wanting to get across by using a person with lived experience. It may be that rather than just getting them to talk, it's helpful to ask questions as a prompt. And I think that also helps the person with lived experience to express themselves most clearly, rather than being expected to simply talk to the camera. As Howard said earlier, this can all be done on a mobile phone. You don't need any specialist equipment. And in the toolkit, there are actually technical tips available which tell you how best to do it on a mobile phone and help you to make the best use of it. And again, also the videos don't need to be long. A short video, 1 or 2 minutes, can be very impactful. And you're going to keep people's attention with the short video, whereas if you record a long video, you may lose people's attention. But a short, sharp message with a really meaningful story is very, very effective. And I would highly recommend the use of films in your World Day, especially with people with lived experience. Next slide, please. Howard also talked about the importance of using the media. And again, this is a good way of telling a story and a powerful way of getting the message across. And it makes palliative care real. And it also makes palliative care not just a scary concept. Palliative care is a word which has got lots of weight attached to it, and people are often very scared by the concept of palliative care. They think if you mention the word palliative care, it means that you're instantly going to drop down dead. And I think it's very important to educate people that palliative care is not just about end of life, and it's not just about cancer. It's about the whole trajectory of illness, and it's about a whole range of illnesses, from non-communicable diseases such as cancer, which is an important need for palliative care, but also heart disease, respiratory disease, strokes, and infectious diseases such as HIV and drug-resistant TB are increasingly in need of palliative care. Include photographs where possible, because this again makes the story more real and has a more powerful impact. But always remember to get signed consent for the photographs. And again, there's tips on this in the toolkit. And as Howard told you, there's a tip on writing a press release in the toolkit, which actually includes a template press release, which you can modify. And this can be modified for use with the person with lived experience story as well. Next slide, please. You can include palliative people with lived experience if at all possible. And you can include them in everything. If you're writing an advocacy letter to a government official, well, then include someone with lived experience as a signatory, as a co-signatory. Get them to help write the letter, get them to help decide what's important. What do they want the government official to know? Really listen to them and take their opinion into account. They're very powerful advocates for themselves if people are given the opportunity. And as I keep repeating, but I repeat it because I think it's so important, value this expertise equally with the professionals. So what they feel it's important to advocate for is as important as what the healthcare professionals think it's important to advocate for. Treat them respectfully and with dignity, and recognise that for some people with lived experience, they may never before have been asked to share their opinion or been listened to in expressing their opinion for advocacy purposes, and they'll need support to give them the opportunity to tell their story. You may need to train them in how to tell their story most effectively. You may need to encourage and support them and reinforce how well they're doing. It's quite intimidating for people to be sitting side by side with healthcare officials sometimes, and it's worth remembering this and respecting it. And finally, films and media are especially powerful, but do, as I say, include people with lived experience, if at all possible, in all aspects of World Palliative Care and Hospice Day, but also in all aspects of your advocacy work with palliative care, not just on World Day. Include us in all aspects of advocacy, whether that's advocacy to policymakers, advocacy locally, advocacy nationally, or indeed advocacy globally, which is where we aim to act. Thank you very much.
Thank you very much, Elena. This ends the slide presentations for us, but we now get to go on to questions and answers. I have to say, just well, first of all, one of the questions in the chat was, what does PWLE mean, which is persons with lived experience, in this case of palliative care. And you know, I think we've had attitudes somewhat maybe paternalistic or maternalistic about involving people, our patients and their families, in advocacy and communications and policy making. And I think we've been taught by people like Helena that that's not sensible, and actually holding back people that have a huge amount to give. I know that, you know, when we have messages that we give at UN meetings, that if we're using a person with lived experience or their voice in those interventions, that they're way more powerful than something that I can say as a person, though I've had some lived experience, quite a bit of lived experience of palliative care from the professional side and personal side. In any event, thank you, Helena. The other question that is in the chat in the Q&A, and please add more questions in the Q&A, was about a solar eclipse apparently happening in Santa Fe, New Mexico, and that could be competition for a World Day event that was planned there. We don't need to be rigidly, adhering to that particular day. You can have events in days around World Day, and they'll still count as events for World Hospice and Palliative Care Day. Though I think it might be an interesting, depending on what time the eclipse is, it could be very entertaining for the attendees at your session. And somehow, I don't know if you can relate the two events. I doubt it. But please, yeah, if you need to move it to Sunday or some other time. And I know that some of the events that are going to be happening for Public Health and Palliative Care International are likely to be a little later than World Day. So please do, when you're doing events, make sure people know it's in celebration of World Hospice and Palliative Care Day, and then add it, as Howard said, to the website for our map. Right. So the next question was, are people with serious neurologic illnesses like Alzheimer's or dementia covered under palliative care? Absolutely. The answer to that is yes. The fastest growing diagnostic group needing palliative care out of all the different non-communicable and communicable diseases is dementia, Alzheimer's dementia particularly. So we see a lot of different kinds of neurological conditions in palliative care, and absolutely, please extend your services to include them wherever you can.
And Steve, can I just add to that?
Please.
I would also say that although it may not be possible always for people with dementia to advocate for themselves, they almost certainly will have carers who are able to advocate on their behalf and should be included in as a person with lived experience of palliative care. A much growing group, and the carers have a particularly difficult time sometimes, and I think it's very important to include them and make them feel that they've got a voice.
Yeah, I think it's helpful for us to understand that we have different levels of palliative care delivery. There's a palliative care approach to care. There's which can be done. We think the majority of people with palliative care needs actually could be cared for by their primary care clinicians if those clinicians had, at minimum, basic training in palliative care, so they understood how to provide relief of symptoms and support for families, and both psychologically, socially, and spiritually. But then, there are people who need specialized palliative care, and in some countries, like the United States, there are insurance rules that determine who gets access to hospice care benefits. So sometimes, for people living with dementia, they'll only be qualified to come into palliative care in later stages. That doesn't mean that their neurologists and people caring for them can't use palliative care principles while they're caring for that person in earlier stages of dementia. The next question is, can you think of a better name or word other than patient or client to talk about people with palliative care? I think, it's always better to refer to people by their name or by their persons, and Helena, you might have some comments on this.
I would agree with the question that I don't particularly like either patient or client. I think person is a much less pejorative and kind of less putting people in a specialized pocket. It's who they are as a person. Their palliative care needs are part of who they are as a person. And I think person is a much better term. I think getting the terms changed is an uphill struggle, though, because I think particularly patient used to be the word, and then because people felt patient wasn't the right word to use, they switched over to client. And I have to say, I think I like client even less than patient. It makes me sound like I'm in a shop or something. But I think I prefer person, and that would be my preferred term. And I think that's why we talk about persons with lived experience of palliative care needs or NCDs or whatever. But yeah, and Guy, obviously.
Guy, go ahead.
No, I agree with you completely, Helen. Is that I've had multiple sclerosis for 20 years, so I campaign for the charities to define people as a person with multiple sclerosis.
Yeah.
The other option, Jan, it's popular but not unanimous, is citizen, but that's not necessarily inclusive, because some people are not necessarily a citizen in the country. But yeah, it's a thorny issue, but I think we should try to get away from the term patient if we're trying to strive for more equitable approaches to decision making, because I think that etymologically it's defined as one who suffers.
Yeah. And we're trying to reduce suffering and improve functionality, and therefore we're trying to stop people being patients. I don't define myself as a patient like Guy. I've lived with the chronic disease for a long time, and I very much see myself as a person who happens to have a collection of diseases. I'm not the collection of diseases, and if I'm continually categorized as a patient, then that categorizes you as a collection of diseases.
Any comment, Howard?
Yeah, I think I agree with what you just said. So I think people or persons living with palliative care needs is more ideal. Sounds better instead of classifying someone as just a patient. They don't feel like their disease. It's not attached to them. They are people at the end of the day, just living with a condition or some conditions.
Diane Van Dyke has a comment. I think we have a mental health program, a step down unit for reintegration and home care. We obviously in palliative care, the myth about palliative care and hospice care is that it's a building you go to. The vast majority of places, it's actually care delivered in a place the person calls home. And mental health issues and mental health concerns are a big part of palliative care. I mean, we care for everybody, and including those with challenges, mental health challenges that need addressing. And sometimes people need care before they can family members in particular need care before they can deliver care. Sometimes, as one of our principles, we have to care for the whole patient and family unit. Family being writ large as the people who sort of immediate attachment network to someone. Friends, family, others. Next question was for Guy. Any key tips or words of wisdom for growing a compassionate community movement in your community? This is a big question, but wondering if you have any for a group or individuals just starting out.
So Howard put up a slide around the Compassionate City Charter. That provides a flexible framework of areas that you might want to consider trying to galvanize activities. But for me, when you're first starting out, I would try and pay special attention to this idea of invitation. Sometimes it's a thorny issue, again, terminologically, around how do you define community? So at one level, you could argue that we need places and spaces to commune. So when we're trying to get something started, how you're inviting people in and how you craft that invitation to find like-minded souls. And then from there, you can use more of an asset-based approach of using the charter. Right, what can we do just to build up some momentum? So that's my recommendation. Think about your invitations.
And you can be recognized as a city, and actually the term city charter could apply to villages or any kind of community of people living here. Yeah. Okay. Ruth Marika Schmieding is suggesting healthcare exchange partner. Something to think about. An anonymous attendee, if palliative care is not recognized yet as a public health care model and not seen as civic responsibility in a country, how does one start or change the social norms or culture? Well, just to start out, that's a hard question, but we have a public health model for palliative care that's published by the World Health Organization. I would encourage you to use it and emphasize the importance of palliative care. And, you know, this is my 48th year in palliative care, and we have had a very hard time getting the public health community to embrace palliative care as a public health issue in many countries, including the United States. It's just not something that they understand as a public health issue, but we understand it very clearly as a major public health issue. You can, there are a number of tools that you could use that are international statements about the right to health care, for instance, and the inclusion of palliative care in universal health coverage. There's the promotion, prevention, treatment, rehabilitation, and palliative care as the continuum of universal health coverage. So there's an obligation for each country, since that is a goal from the UN for health and well-being in the UHC 2030 effort to try to improve life on our planet by 2030. So those are some tools. Guy, any thoughts on that? Additional thoughts?
I guess I draw just attention to the Lancet Commission on the Value of Death, only because they rightly so that say that palliative and end-of-life care in this context has become unbalanced. So in areas of the world it becomes overtreated, in other areas it's significantly undertreated. And I think that, well, suggestions around changing kind of culture and norms in those areas where it's become overtreated, medical profession is actually struggling with demand. So there is a need rather to approach this from understanding from both professionals as well as community levels, is that it's not sustainable in our current trajectory of travel.
Howard or Helena, any comments on that? Okay. Vanessa was saying, we've been thinking of another term for palliative care because it is often viewed negatively. Any suggestions? My first comment about that is that whatever name we give it is going to end up becoming associated with, serious illness and dying. And the term palliative care was originated in 1976 by Balfour Mount in French-speaking Canada and Quebec, because the term hospice was translated in at least in Canadian French to poorhouse or something similar to that. So he just adopted that name as a different word for hospice historically. Some people have been using the term supportive and palliative care, but I think we have to be careful not to talk about supportive care as something different than palliative care, since palliative care is all supportive. At least in one respect. So I think we have to stick with these terms. It confuses the public if we keep changing the names of things. And actually, most people don't even know what palliative care is. So it's really up to us to define that for them. And we can talk about it in ways that are quite engaging to people. Extra layer of support around the patient and family, the work that the family does, as Guy pointed out, 95% of work is one of our secrets is that we help that happen by providing support 24/7 to the families while they're doing this work, and just treating them as well as helping the person. And now the guy from Sudan has said, or recipients of care. That's another term we can use, recipients of care, to talk about our population. And I hope things are okay with you, Malia. So I'm not seeing any more questions in the chat, and we have come to the top of the hour. I want to thank, first of all, our panelists this day, Helena, Howard and Guy, and thank you all very, very much for joining us today. And please keep in touch. Let us know how your efforts to build World Hospice and Palliative Care Day are going, and take care, do good work, and keep in touch. Bye for now.